Hello everyone, welcome to my channel. Today we have another immunology question for step 2. If you'd like to see more step 2 questions, please like and subscribe. A 29-year-old woman comes to the clinic due to fatigue, intermittent low-grade fevers, and pain in her wrists and fingers for the past month. She recently noticed that a red rash has developed across her cheeks after spending several hours in the sun. She also reports several painless sores inside her mouth and increased her shedding over the last few weeks. Vital signs show a temperature of 37.9. Physical examination reveals an erythematous rash over the bridge of the nose and the cheeks that spurs the nasolabial folds. Several shallow ulcers are present on the hard palate. Laboratory studies show hemoglobin uh, is slightly low, so she might have anemia. Leukocyte count, uh, she has leukocytosis. Platelet count, and she has low platelet counts as well. So none of these are good. Let's read the question. Which of the following is the most appropriate initial test to support the suspected diagnosis? A. HIV antibody testing. HIV can lead to some of the symptoms we can see here, such as anemia, leukopenia, and low platelet counts. And it could also lead to fatigue and mild fevers, but uh, it doesn't explain all of the symptoms we have here. And I'm not going to go for A. B. Rheumatoid factor measurement. Rheumatoid arthritis can lead to joint pain and fatigue, but it doesn't explain everything we have here. And so I'm not going to go for B. C. Bone marrow biopsy. Bone marrow biopsy can be used for detecting leukemia and lymphoma, which can cause similar basically symptoms to what we have here, such as, I guess, mild fever and cytopenia. But many of the symptoms we have here are actually not explained uh, by any of these conditions that bone marrow biopsy could potentially detect. So I would say C is not the best option either. Heterophile antibody testing. This can be used to detect infectious mononucleosis, which could lead to um, cytopenia that we are seeing here, and also it could lead to some dermal conditions, and those dermal conditions are not similar to what we have here, because right now we have a photosensitive rash, and that's not exactly what we have with infectious mononucleosis. So I'm not going to go with D. E. Anti-nuclear antibody assay. Anti-nuclear antibody assay can be used to detect systemic lupus erythematosus, and that condition explains many of the symptoms we have here, such as photosensitive rash, such as the joint pain, the mild fever, and to be honest, many of the symptoms that we have here, importantly, cytopenias, anemia, leukopenia, and thrombocytopenia, all are explained by systemic lupus erythematosus. So I'm going to go with E. That's the right answer. Like and subscribe if you would like to see more of these videos. Thank you.